listening to the My City, My Health podcast. I am your host, Laurna, and today I'm excited to introduce our guest, Naomi Marroquin. So welcome, Naomi. If you are comfortable, I would love to just jump right into the questions. So if you could introduce yourself to the listeners.
Yeah. So, hi everyone. My name is Naomi Marroquin. I am the healthcare team lead in the eastern side of the state of Iowa. I'm actually located out of the Iowa City office, but I do travel a lot, and we'll talk about that a little bit later, across the eastern side of the state to provide healthcare services to migrant and seasonal farm workers.
All right, thank you. So going off of that, what inspired or continues to inspire your work with migrant populations?
Yeah. So I actually grew up in a small town called Storm Lake, Iowa. It's in northwest Iowa. So if you've ever been out in Storm Lake, it's a little bit different because rural Iowa, it's very rural, but Storm Lake's a little bit different because we have a lot of immigrants. So it's a very immigrant-heavy community. So I actually grew up. That was all my life. My parents are Salvadorian immigrants who ended up immigrating to California. From California, due to some like gang violence and stuff in Los Angeles, my parents decided they wanted to move out of California because they both grew up in the Civil War in El Salvador. So at the time, they were offering like jobs at IBS, which is now or IBP, sorry, which is now Tyson. So my dad was just kind of like, let's try it out, and we ended up moving out to Iowa, and they never left ever since. Growing up, a lot of my peers actually have like the very similar story where they were just kind of the parents were recruited out to work here. We're out there in Storm Lake, and so I grew up with 30 plus different cultures, of all different backgrounds, a lot of Latino background, Asian, African, like everything you can think of. So growing up where I grew up, I also saw a lot of like health disparities, a lot of barriers to access healthcare. And once I graduated high school, I ended up going to study at the University of Iowa. I kind of first entered off as a nursing interest, and then I kind of quickly realized that was not for me, but I kind of still wanted to stay in like the health space. And then, public and global health really grabbed my attention. So I started studying global health at the university, and ended up doing some research projects through the College of Public Health as well, that we focus on like the health disparities between like undocumented immigrants or immigrants in detention centers. And through that research as well, I just knew like I wanted to really focus on immigrant health, not only through my personal background and how I grew up, but also through this research, I realized that no one else was doing this type of research or this work. And I knew I wanted to like kind of like bridge that access or kind of just like learn more so I can help the community more.
Thank you for sharing that. And it's really important work that you are doing. Could you talk a bit more about your experiences as a community health worker with migrant and seasonal agricultural workers?
Yeah. So, you kind of as a community health worker, I kind of believe like you're more just like an advocate, you're so integrated with the community, because we are part of the community. So not only within my Iowa City office, but with everywhere I do mobile clinics at as well. You just see a lot of overworked people who are underpaid and also just like tired, like their bodies are tired. They are just tired from working very long hours, very heavy work that no one else will do. So as a community health worker, I like to help like tailor to their needs. So whether that's just helping them with a resource in the community or just helping them translate a piece of paper, that's even outside of like clinic, or people call for different things, like I really don't mind, because sometimes they don't have anybody else to turn to. So I think that is probably one of the biggest experiences is just being a resource to everyone and anyone who needs it.
What unique challenges do you face in your profession when it comes to providing different resources to the populations that you do serve, and how do you address those?
Yeah, I think one of the biggest challenges that I face, and also I think just like as an organization, is because we're federally funded, there's also limited funds. And I think when you're working with limited funds, it also you have to be creative with the way you work. Just because we know like funds only go so much. So I think that's one of the challenges. I could say is a challenge, but it's also I guess we have learned to like embrace the way we do work. So we unlike mobile clinics, we don't have a mobile van at the moment. So we set up anywhere. I have set up in laundry rooms, warehouses, cafeterias, churches, community centers, wherever I can get a space to host us. Another thing is not only my challenge, but like our patients' challenges, is they don't have access to like, if they have no access to transportation, we help. How are they supposed to pick up medications, or how are they supposed to go to their optometry visit that we're referring them to? So we bring an on-site pharmacy with us to help distribute medications right there and then. In my region, we also help, transport patients to go to like optometry visits, for example. And I think, again, kind of like the unique challenges is a lot of our patients also deal with a lot of chronic health illnesses. So having to not only educate them, but also with what's around them, because I can't say, cut out these carbs and you should be eating more veggies and, incorporate X, Y, and Z when they don't have access themselves to a local grocery store. So how do I use what's around them to help, and those tools to help better them or help give them the tools they need to better themselves?
And I've heard you talk about the mobile clinics that you guys do within the company that you're working with. How often are those mobile clinics? Like how many times, I guess a year, if you will, or even in a month, do you guys tend to, or are you guys able to do those?
Yeah. So like right now it's kind of like the off season, we can say, for me. So right now I have like 2 mobile clinics in a month. But during the summertime, so between late April, May, up until probably October, we have a very huge influx of migrant workers who come from Texas, Mexico, South Africa, and they come to work on our fields. And so at that time, we usually have 3 or 4 mobile clinics a week. So it's a very big difference. So during the summertime, we get very busy and just travel throughout the state. Some are very close by, maybe half an hour away, but some are 2+ hours away. Something else, and that, yeah, like I said, like a week. And then there's also things that we call onboardings. So sometimes there are mobile clinics that we do that are kind of like a one and done situation where at the onboarding, that's the only time we can see them. And if we don't see them, we probably lost our shot because they're right out working and schedules differ. Everyone's at different housing facilities or whatever it may be. So just kind of, it becomes harder at that point. So sometimes we just have like a random mobile pop-up at wherever they work, for example, and we'll just do the mobile health clinic there, then and there.
Oh, thank you for giving me more information about this. So how has being a bilingual and bicultural healthcare professional influenced your approach to caring for migrant communities?
I think I just can relate to them. And I think that's like the biggest thing is being able to relate to them, because not only can I speak their language, but I also look like them. And I think that helps in a way put our patients at ease. Or at least like grow some rapport with them, and they can ask questions that sometimes maybe they don't want to ask anywhere else. So I think that's like probably the biggest thing. And I think we also at Proteus really pride ourselves in being able to provide our services in their native language. If I'm being honest, probably like 90% of our patients are Spanish speaking. So a very big chunk, 85-90% I would say. So being able to offer our services in Spanish so that they can also understand us, I think is very important. So from the moment they check in to see us in vitals and labs, to seeing the provider, everything is all in Spanish. And if we ever have a provider who doesn't speak Spanish, we always have an interpreter present. So nothing is ever, we want to just give them as much information and like provide the care as best as possible. And I think that's very important to how we deliver our healthcare services.
Yeah. And I like how if you don't have an interpreter, or if you don't have someone that does speak Spanish, you offer the interpreter, because I know that seems to be a large issue.
Yeah.
To where that language barrier, it's like, oh, sorry, we don't,
Yeah.
I can't speak with you because I don't know that language, and vice versa. And then that just kind of ends there a lot of the time, which is the opposite of what we want.
Yes,
So
I know. Yeah.
I love that there's that other option. I guess, what changes or improvements would you like to see in the future for healthcare services aimed at migrant and immigrant communities?
A lot. No, I think healthcare is always evolving, and I think that we can also evolve even within our own like services or every hospital and clinic. I think one of the biggest things, I know we talked kind of about like community health workers or like navigation programs. I think it would be really nice to have. I know that's probably a far-fetched dream, but
That's
I think
okay.
it's like one of those things where, like I said, a lot of people just don't know their local resources. So they don't know how to get connected, where to go, and sometimes you just need somebody who can help you access that, or at least kind of just guide you away. I know we kind of just talked about it, but I think ideally, in the ideal world, like I believe every hospital and clinic should have at least one in-house like Spanish speaking interpreter, or someone who speaks French, or at least some bilingual interpreter, because although a hospital can never turn you away if they can't speak the language, however, they might use like a language line, and again, things get lost in translation. It's just not the same. Sometimes just the mannerisms, or like kind of like just seeing someone makes a difference. So I think that's another thing that would be really cool, like change or improvement across healthcare, is just like in-house interpreters and like in-house like community experts, because I know doctors are busy as well, and doctors are there to see their patients, and it may not go any further than this, or they might tell them, okay, you now need to go do XYZ, but maybe a patient doesn't know where to go for that or how to do that, so they just need the tools. So yeah.
And then maybe one of my last questions is, what advice would you give to current and future healthcare professionals who want to better serve migrant and immigrant populations?
I think my biggest advice is just like listen to them. Don't assume just because maybe you did research, or maybe because a friend that it worked for them, it might not work for the other person. I think another thing is, I think healthcare professionals should be like maybe more aware, in the sense of think of like other options, like or look into options or programs in the community that might benefit patients, like whether of a local free clinic, or where to get like a cheaper x-ray ultrasound. I think that is also helpful, because the questions might pop up when you're in the with the patient, and I think it's also important to like know those things, because unfortunately, like, I think a lot the immigrant populations, like they're already underserved. they might be underinsured or uninsured to begin with. So they really do only have limited options. I can't tell a patient who's uninsured, like, hey, and undocumented, let's add that as well. Like, hey, you got to go see a cardiologist. But if you don't qualify for Medicaid or any insurance, is there any financial programs at X hospital? Or how can we is there any like volunteer physician networks or programs that we can get you connected to? And then I think also, if there is any current or future healthcare professionals, volunteer time if you are able to. I think there are a lot of community health centers or free clinics or volunteer physician programs that could benefit not only them, but as well as their patients. Could benefit from just your help, even if it's 4 hours a month, I think there's always things you can do to help improve and also better your own community. Because although they may be your patients, you have to also remember, like, they're in our community as well. And they also just need help. That's why they come to see us. And don't be afraid if you don't know Spanish or a certain language. I think that also as well, like, people will appreciate the care. I promise. People really appreciate it.
Yeah. Because I guess sometimes all people really need is someone that does care.
Yeah.
That really does make a difference.
Yeah. Like, I know, for example, here in Iowa City, there's like a local free medical clinic, and they have like physicians who come in and volunteer, let's say dermatologists. But if they only come once a month, like, you can imagine how long the wait list gets, or, like how long they might have to wait till the next appointment. So I know doctors are probably burnt out as well, especially with after I feel like COVID pandemic, like, we just need more healthcare resources and members. But sometimes just, even if you want to get a different, go in a different environment, because I know working at a big hospital might be a little bit different than working at like a local clinic that doesn't have as many resources as you may think. So
yeah. And I like how you acknowledge, like, burnout is a real thing.
Oh my gosh, yes.
Most definitely happen. What do you do, or do you have any like thing specific that you do when you feel like you're really stressed out, or if you're getting ready to hit the point of burnout?
I kind of just remind myself, like, why I'm here, if that makes sense. Like, I especially, like I said, during the summertime, I get very busy because of the migrant workers, but like, they're also my favorite part of the year. Like, I might be burnt out, but at the same time, like, I love working with them, and I love interacting with them every single day. And like, I love seeing them smile and like want to hear the advice and want to learn. I think I have never gone to a clinic where I hear like someone say like, "Oh, gracias, mija," or like, so like, thank you. Mija is very like, I feel like I don't even know how to say it, like a word of endearment, I guess, or like they always feel like, they always tell me like how much they appreciate it, or they're really thankful for our services. So that kind of keeps me going. And then also a couple of years ago, I kind of learned like the work will always be there. Like, whether we wanted to or not, like, it will always be there. So we deserve the vacation that we want to have, or, we earn the pay time off that we have accumulated. So take the days off, take the week, like, sometimes it's scary. You're like, oh, I can't leave for a week because all this has to be done, but the work will always be there at the end of the day.
Thank you for sharing. I guess this is kind of all the questions I had prepared. Thank you so much. If you are comfortable, where would the audience or listeners be able to find you? Like, on social media, if you want to?
Yeah, so I'm on LinkedIn. Again, Naomi, Naomi, and then my last name is spelled M as in Mary, ARROQUIN. That's also my Instagram handle with an underscore. But also, I would also kind of give a shout out to Proteus, the company I work for, and you can look them up at proteusinc.net, so proteusinc.net. Check out their website, check out what counties they're in, check out what they do, because although I work for the health program, there's also another program within our organization that helps with like health advancing in like education, job placements, career coaching, and all that stuff. So I would say check us out, and if you have any friends, family, or potential patients who kind of need a resource or help, kind of guide them our way. On the website, it has like our phone numbers, what regions we're in or serve, where we at, and how to get a hold of us. So I would definitely also want to plug that in.
Yeah, of course. It's important, just another resource for people to learn more, right?
Exactly.
Thank you so much for coming on the podcast today. I truly do appreciate it. And yeah, I'm excited to see you at the conference and have that other conversation.
I know. Thank you for inviting me. And
of course.
Yeah, we'll see each other in April.
Yes, I'll see you in April.